Hi there. If you saw the title saying 2,400 deposits coming, you're in the right place. In just a moment, I'll walk you through what's really happening with Social Security, SSI, SSDI, VA benefits, stimulus talk, Medicare, and more, and what you should do now to make sure you don't miss out. We're seeing a lot of chatter and anxiety among seniors this fall about possible new payments, benefit changes, and deadlines. Many of you are already relying on Social Security, SSI, Supplemental Security Income, SSDI, Social Security Disability Insurance, or VA, Veterans Affairs benefits, just to cover basic living costs, medical bills, and necessities. With inflation still pressing many fixed-income households, any extra dollars count. Plus, in 2025, we have some big shifts. The Fairness Act just passed, paper Social Security checks have ended, and the looming government shutdown is creating uncertainty around the next cost of living increase, COLA. So now is exactly the moment to get clear on what's real, what's rumor, and what steps you can take to protect your income. Let's begin by tearing into the claim $2,400 deposits coming. As of October 2025, there is no confirmed official federal program that mandates a one-time $2,400 payment for Social Security recipients, SSI or SSDI beneficiaries, or VA recipients. Rumors and speculative headlines have been circulating online, but the IRS, SSA, and VA have not announced such a payment. Many of these rumors are tied to cycles of stimulus check talk, but there is no law passed that authorizes a fresh, blanket $2,400 deposit as of now. It's wise to remain hopeful, but also cautious, and to focus on benefits and changes we do know are confirmed. First, let's talk about Social Security retirement benefits. In 2025, beneficiaries received a 2.5% cost of living adjustment, COLA. This means your benefit was boosted slightly to help keep up with inflation. The average monthly Social Security benefit for retirees is now around $2,000, though that number varies widely depending on your earnings history, when you started, and other factors. Because of a new law passed earlier this year, known as the Social Security Fairness Act, signed in January 2025, two long detrimental rules, the Windfall Elimination Provision, WEP, and the Government Pension Offset, GPO, have been repealed. That means retirees who also had a government pension may now see higher benefit checks than they have in years. This is very good news for many public sector retirees, teachers, and others who had seen reductions. In October 2025, Social Security payments are dispersed on 3 separate dates depending on your date of birth. October 8 for birthdays 1 through 10, October 15 for birthdays 11 through 20, and October 22 for birthdays 21 through 31. Those dates reflect the regular schedule for retirement and disability benefits. SSI, Supplemental Security Income, payments, on the other hand, are issued on October 1 and again October 31. The latter is effectively an advance payment of November's benefit. If you don't see your check on the expected date, the SSA recommends waiting 3 extra mailing days before contacting them. Another major shift. As of September 30, 2025, paper Social Security checks have been discontinued. That means all benefit payments must now be delivered electronically, either by direct deposit to your bank or via a prepaid debit card option such as the Direct Express card. This change was mandated to reduce fraud, streamline the payment system, and speed up delivery times. If you were still relying on mailed paper checks, you'll need to confirm your direct deposit or card setup as soon as possible to avoid disruption. Now, shifting to SSI, Supplemental Security Income. SSI is a federal program for people who are elderly, blind, or disabled and who have very limited income and resources. SSI is not based on work history. It's based on financial need. For 2025, the maximum federal SSI amounts are $967 per month for an individual, $1,450 for an eligible couple, and $484 for an essential person, someone required to live with you and receive support. However, your actual payment depends on your countable income. If you have any income, it will reduce your SSI benefit. If you change living situations or income sources, always report them promptly to avoid overpayments or underpayments. Most SSI recipients got the 2.5% COLA with Social Security. And since the government shutdown could delay the next COLA announcement, we don't yet know exactly how much SSI will increase for 2026, but projections hover around 2.7% to 2.8%. Let's talk about SSDI, Social Security Disability Insurance. SSDI is for individuals who've worked and paid into Social Security but now can no longer work due to a qualifying disability. Your benefit amount is based on your earnings record, in much the same way as retirement benefits, but SSDI kicks in earlier because of disability. As of now, there has been talk from some in government about tightening eligibility rules for SSDI, especially for older Americans, which could reduce how many qualify. For example, proposals suggest limiting how often age can be considered in disability determinations. If that proposal becomes law, some older applicants may be denied or have to accept lower benefits. So if you or someone you know is applying or already receiving SSDI, stay on top of your documentation, make sure medical records are up to date, and keep great contact with your SSA representative. Now, VA benefits for veterans and surviving spouses. Some of the rumors of $2,400 deposits sweep in VA recipients as well, but there is no confirmed VA-wide deposit on that scale as of now. VA disability compensation, pension benefits, survivor benefits, and related programs remain in place as usual. If you are receiving VA disability, service-connected compensation, or pension, continue to monitor your VA account or statements for any announcements. In general, VA benefits are unaffected by SSA's COLA processes, though some adjustments may occur in certain combined programs. Because VA benefits often supplement Social Security or SSI, it's wise to coordinate both sides of your support network. If you haven't already, log into your VA account and verify that your direct deposit and contact information remain current, especially with the push toward electronic payments. Let me address stimulus checks. Many of the viral headlines you may have seen, claims like $1,800 stimulus check for SSI, SSDI, and VA recipients, or $2,400 check on the way, are speculative and not backed by any official announcements. Some websites are misreporting unpassed bills or theoretical proposals as fact. Always rely on official sources like SSA, IRS, or VA announcements. As of now, there is no legislation in place for a new stimulus check over and above your existing benefits. If such a proposal ever passes Congress, those sources will have the precise details, eligibility, and timeline. Let me also mention Medicare and other senior-focused assistance programs. For most seniors over 65 or those under 65 with qualifying disabilities, Medicare remains the core health insurance option. In 2025, there have been modest changes in Medicare Part B and Part D premiums, deductibles, and cost sharing. Be sure to check the official Medicare site or your annual Medicare and You handbook for the latest. Some low-income seniors may also qualify for extra help to pay Part D prescription drug costs or for Medicare savings programs to offset Part B premiums and cost sharing. Additionally, many states offer property tax relief, utility assistance programs, food assistance such as SNAP, or energy help, and supplemental health plans, Medigap. If you haven't recently reviewed whether you qualify for new state or local aid, now is a good time to check. Many of those programs have enrollment windows or income thresholds that change yearly. Because we're in October and the federal government is currently shut down as of October 1, 2025, some pending announcements might be delayed, especially the next COLA, which is typically announced mid-October. The Bureau of Labor Statistics collects the inflation data needed to compute COLA, and furloughs or delays there can push back the announcement. The SSA must publish the COLA by November 1, so even if delayed, beneficiaries should still receive benefit increases by January 2026. To illustrate with numbers, in 2025, the maximum Social Security benefit for a retiree at age 70 with maximum earnings is $5,108 per month. That's for someone who earned the maximum taxable amount for at least 35 years and delayed claiming until 70. But most recipients receive far less than that. Many fall in the range of $1,500 to $2,500 depending on their history. Also, thanks to the Fairness Act, some folks who previously had benefit cuts under WEP or GPO may now see increases. Now, what you can do now, some actionable advice to protect your benefits. First, verify your payment method. If you are relying on a paper check, switch immediately to direct deposit or a prepaid card option like Direct Express. Don't wait until a payment is late. Do the update now. Second, check your SSA, SSI, SSDI, and VA accounts online or via phone to make sure your personal information, address, bank routing, direct deposit, contact phone are current and correct. Third, gather and maintain documentation, medical records, proof of disability, income statements, proof of service for VA, etc., so that if there is any audit, review, or reevaluation, you have what you need. Fourth, stay aware of upcoming COLA changes or legislative updates. Even though the government shutdown could delay the news, economists currently estimate a 2.7 to 2.8% COLA increase for 2026. That could add somewhere around $50 to $60 per month on average to your benefit, but your actual increase depends on your current benefit level. Fifth, consider consulting a benefits counselor or elder law attorney, especially if your financial situation is tight or you receive multiple benefits. Sometimes slight optimizations, coordinating VA with Social Security or using state programs can make a meaningful difference. Sixth, watch for formal announcements, not just headlines or social media rumors. Sign up for email or text alerts from SSA, VA, and trustworthy senior advocacy groups in your state to make sure you hear real updates as soon as they are released. If you've had experiences with changing benefits, transitions to electronic payments, or navigating new regulations, please share them in the comments below. Your story might help someone else in the same boat. And if you find this information helpful, hit the like button, share with friends or family, and subscribe so you don't miss when a real $2,400 deposit is announced, if ever. To wrap it up, the bold $2,400 deposit title is, for now, speculative, not confirmed by official sources. But there are real, confirmed changes happening. No more paper Social Security checks, the repeal of WEP and GPO under the Fairness Act, ongoing COLA processes, and potential changes in SSDI eligibility. Your priority now is to make sure your payment method is up to date, all your accounts and documents are current, and that you stay keyed in to official announcements. Early action protects your income from unnecessary delays or disruptions. Thank you so much for watching. Stay organized, stay informed, reach out if you have doubts, and take care of yourself.